Okay, thank you. So there are some signs that should be looked out for during pregnancy. Do you understand? So I just want to go through some of them quickly. If at any point in pregnancy you notice blood, that is straight. I mean, you have to go to the hospital immediately. Immediately. That's you need to see a doctor immediately about that because it could be an abortion that is about. It could be a threatened abortion. It could be an actual abortion. You know, in any instance, vaginal bleeding during pregnancy should warrant a visit to the doctor immediately. Leakage of fluid from vagina too is another indication to see the doctor because that could mean that your membrane has ruptured. Do you understand? And usually, in cases like that, you might have to be induced or you might have to, at least be on bed rest for a while, but you need to see a doctor immediately. Cramping pain of the abdomen. So if you start feeling sudden severe pain in your abdomen, especially in people that have fibroids, or even if you don't have fibroids during pregnancy, it's very important to see a doctor. Fever during pregnancy is very important for you to visit the doctor immediately. Chills when you're feeling cold during pregnancy is very important to see the doctor. When you are urinating and you notice a burning sensation, pregnant women have a higher chance of developing urinary infection. So it's very important for you to see a doctor immediately about that. So the infection does not ascend upwards from the urinary tract and then affects the baby. So continuous headaches are also very important because this usually can be a sign of hypertension in pregnancy, and hypertension in pregnancy is a big problem. It's one of the major causes of maternal mortality. So if you're having constant headaches, please make sure you see the doctor. Please make sure you go and book your pregnancy with the doctor immediately. Another thing is facial deviation. So facial deviation is at the spectrum end of continuous headaches. So when you notice facial deviation, that's more often than not in the next few hours the child has to come out immediately because that's showing that the hypertension is so severe that it's causing, basically that's a stroke that is happening already in pregnancy. Pregnancy can be very funny and very interesting thing in that a lot of things can change very quickly. If a child, I remember I saw a similar case, a woman that came in with facial deviation. In the next 2 hours, we had to take the baby out because if we leave that, the woman and the baby are going to be gone. So if you notice any form of facial deviation, it's very important to make sure that you visit the doctor immediately. And also, if you notice that you're okay, even if you just feel it, the number of times the baby kicked yesterday, maybe yesterday it was 10, today is 8, please immediately see your doctor. While you might not be objective, the doctor will be able to be objective and tell you, okay, do this, do that, do this, let's do this, let's do that. Do you understand? But at the first chance of noticing that the fetal movements are reducing, the baby is not moving as much as possible, the baby is not kicking as much as possible or as much as often, please make sure you see the doctor because you see a lot of women that want to wait it out. Maybe it's just a 1 day thing, maybe just a 2 day thing, and in that period you can lose the child, and I'm sure none of us wants that to happen. So please, it's very important to visit the doctor as soon as that happens.